Hello, I am Susie Torres, the Utah Ambassador for the Foundation for Sarcoidosis Research. And I just want to tell you before I get started with today's topic that I went out with a friend for coffee and I have been feeling horrible this week, like really bad. Like last night, I was thinking about going to the emergency room. But going out for coffee, well, I probably drank my coffee too fast. It gave me a little buzz, but I think just going out and being with a friend, forcing myself to spend time with a friend, so good for my spirit. And so I want to encourage all of you guys, make time for socialization. Push yourself. Make it a priority as if you needed to get up and go to work. Because having friends and socializing is really important. So, okay, off my soapbox. So I know I was gonna do treatments next, but I guess I'm having a little issue with that because of personal stuff that's going on with my treatment. So I will get to that later. I decided today I'm going to do symptoms. Oops, just knocked over my Powerade, but the lid was on, so we're good. So I'm still using stopsarcoidosis.org. And it's still under what is sarcoidosis and symptoms. So before I get started talking to you about what it says on the website, symptoms vary widely. I feel, in my experience of being a year diagnosed with sarcoidosis, almost any symptom can be a symptom of sarcoidosis. I feel like the most common are fatigue and shortness of breath. But since you can get sarcoidosis anywhere, you can have any symptom. That's my belief. My first symptom was tachycardia. Well, okay. My first symptom that made me go to the emergency room and demand diagnosis was tachycardia and fatigue. So here it says, the signs and symptoms vary widely depending on what organ is affected. That really makes sense, right? According to this, there are a lot of people with sarcoidosis that have no signs or symptoms. So it's possible I was one of those people once upon a time, but I guess if you're one of those people, you're not looking for treatment, right? So I would think, I don't know, how do they know who those people are? They accidentally get diagnosed with sarcoidosis? That seems unlikely to me, but who am I to argue, right? Others suffer debilitating effects that can interfere with daily life. That's me. That's why I don't work and don't do much else either. Let's see. It is important to discuss all symptoms with your physician so they can arrive at a correct diagnosis and develop the best treatment plan for your unique case. It's interesting though, because when you get as many symptoms as I do, I find the doctors get overwhelmed and they don't know what to do with you. That being said, I still think it's important to find somebody that you can share all your symptoms with. And if you find that they're overwhelmed, pick out the most important ones, or keep searching until you find a doctor that can help you. I went through 5 neurologists last year, and the last one was a keeper. He's awesome. His name is Dr. Scott Belliston. He's in Provo. Okay, let's see. When patients are first diagnosed, they often present with a classic set of signs described as Lofgren syndrome. I was not diagnosed with that, but that includes fever. I do have fever. It comes and goes whenever it feels like it. And sometimes it doesn't last very long. Enlarged lymph nodes, I definitely have that. Swollen and painful joints or arthritis. I do have painful joints, but they don't swell. Oh, here I am again, not knowing how to pronounce things. Erythema nodosum, raised red and tender bumps to form on the skin, usually on the front of the legs, nearby joints, or the nearby joints are often swollen and painful. So I actually sorry, out of breath. I actually had that symptom for like at least 10 years before I was diagnosed. I just accepted having a rash. And there I have one. I can actually show you right now. That is on my knee. If I can figure out how to show you my knee. Look. Oh, there it is. My beautiful rash on my knee. There you go. So those rashes are just a part of my life. And I try not to stress about them anymore because I just deal with it. Okay. Often the presence of erythema, sorry, I don't know if I'm saying that right, nodosum is a good sign indicating the type of sarcoidosis that also goes away on its own after a few months or years, often without treatment. Okay, that might be true for somebody, but not for me. Okay, common signs. Because sarcoidosis so often affects the lungs, other common symptoms of sarcoidosis include shortness of breath. I guess you know I have that, right? Wheezing, I have that. Chronic cough. My cough comes and goes. Some patients will also experience chest pain. I have that. Others will have no signs at all, even when inflammation is present. I don't know what that's like. Okay, other symptoms. Because sarcoidosis can affect any organ in the body, a wide variety of symptoms can be seen, including fatigue. And oh my gosh, so I feel like most of the people that I talk to with sarcoidosis suffer from this. And when I say fatigue, a lot of people that have experienced fatigue, they just have no idea. This is like, have you seen that documentary about the lady with chronic fatigue syndrome where she's just laying there and she doesn't feel like she can even get up to go to the bathroom? It's that kind of fatigue. It's the kind of fatigue where you have to go to the bathroom, but you're so tired that it's like, can I really do this? I used to be the kind of person that got up, brushed my teeth every morning without even thinking about it. Now, it's a long thought process. Am I ready to brush my teeth yet? It's no longer the first thing in the morning because after going to the bathroom, I have to rest. I have to sit down while I'm brushing my teeth a lot of the time. Unexplained weight loss. Unfortunately, I don't have this one. Sorry, I know. People with unexplained weight loss don't like comments like that. That can be a symptom. Night sweats. I don't really sweat because of my neurological issues, so I don't have that one. Overall feeling of sickness. I do have that. In the beginning when I was searching for a diagnosis before I knew I had tachycardia, I used to go to the ER and they'd be like, what's your symptom? And I'm like, I don't know, there's just something wrong. I just don't feel right. Doctors don't like when you say that because they don't find it very helpful. Irregular heartbeat. So I have that. My heart races. Swollen legs. I don't have that because I'm dehydrated. Headaches. Oh my gosh, do I get headaches? Visual problems. Yes, I struggle with blurry vision, floaters in my eyes, eye pain. Weakness or numbness of an arm, leg, or part of the face. Now this is interesting. I used to blame that on panic attacks. So have you guys ever gone to the doctor because your arm went numb and they're like, oh, it's anxiety? Nope, it's not. My first experience, I was getting ready for work. I want to say it was 2003, and my left arm was just numb. And I was like, am I having a heart attack? So 2003, I would have been 32 years old, and it was terrifying. So I sat in my bathroom and I cried and I waited for it to go away, and I got better and I went to work. So it only lasted a few minutes, but that was the first time that happened to me. Discoloration of the nose, cheeks, lips, and ears. I don't feel like I've had too much of that. I do get really red blotchy in my face. I was always blaming that on my Irish heritage, but maybe that doesn't happen to all Irish people. Joint pain. I have suffered with joint pain almost all my life. Muscle swelling and soreness. So my muscles, I don't know if they swell, but they definitely, I deal with soreness. I was diagnosed with fibromyalgia Well, I was diagnosed with chronic fatigue when I was 19. I guess I already told you this. And fibromyalgia when I was 25, something like that. Arthritis, I don't have that, thankfully. Burning, itching, tearing, or pain in the eyes, I do have that. Red eyes. So before I was diagnosed, one of my symptoms is that blood vessels would just break in my eyes and I look like a scary monster from a horror movie. Sensitivity to light and blurred vision. So I have experienced both of those. And it says, note that this is not an all-encompassing list. There are many more signs and symptoms that can be seen in patients depending on the organs involved. So that is all for today. Next time I will talk about causes and risk factors. Thank you. Have a great week. Bye.